Hi, everyone. Thank you so much for being here. I'm super excited today for the guest that we have, Dr. Rawls. And as I was saying to him before, if you've heard a lot about my journey, it was a lot to do with I had undiagnosed Lyme disease. And Dr. Rawls is a name that is coming up in that community so much. And so super excited to have him here. But Dr. Rawls, I know you've done a ton of research and everything with Lyme, but would love to hear your story and just how you got where you got.
Sure. Yeah. Well, my story is probably in some ways like most people's story. It didn't particularly start with a tick bite. In fact, 95% of the people that I talked to over the past decade don't remember becoming acutely ill around the time of a tick bite. So I've been a physician for about 30 years, and I went into obstetrics and gynecology because I really didn't want to deal with chronic medical management of chronic illness. OBGYN was more wellness oriented. It was bringing life into the world, and I really enjoyed it. The downside, though, practicing in a small town, is I was taking call every second to third night. And after 15 or 20 years of that, it caught up with me. I was one of those physicians that if someone was in labor or somebody was in the hospital, I didn't sleep. My attention was on them. So I was chronically sleep deprived. And at that point in time, I wasn't watching my diet. My health habits were not great. And the years and years of that, of just pushing the stress button and pushing the limits of existence, caught up with me, and I crashed and identified first with either chronic fatigue or fibromyalgia because doctors really couldn't tell me what was wrong. I checked my thyroid, it was off a little bit, tried thyroid hormone, that did nothing. So like so many people, I just ended up in this space of not really having a diagnosis. And like many of those people, I kept working at it until I found that I was carrying those tick-borne microbes, that I would have something that I could treat. And I took antibiotics and they made me sicker.
Yep.
And that's when I started looking at alternatives and really questioning this whole approach to chronic illness. And it led me to a different place. And that's where I have been for the past decade and a half, is really understanding this thing we call chronic Lyme disease and how that really connects with all chronic illnesses. And I'm not saying that all chronic illnesses are caused by Borrelia, the microbe that is associated with Lyme disease, but I am saying there's a microbe connection and there's a lot of commonality between all chronic illnesses. And this thing of defining which diagnosis somebody has is often just kind of chasing your tail.
Yeah, no, I just, it resonates so much with, me and what I've gone through too. But what did you find too with the meds and making you sicker? So, for people listening, I know it's really difficult to diagnose. So I guess I should even start with, how should people go about trying to figure out their chronic illness, and how do they figure that out, and who can they work with?
Sure. Well, I'll tell you the conventional approach, and then I'll tell you what I've been doing for the past decade of my life. So we all know that we're ill because we get symptoms, right?
Mhm.
So symptoms are that first thing. We start getting brain fog or arthritis or irregular heartbeat or any range of different symptoms. And symptoms come and go, but when they stay and don't go away, eventually you say, yeah, something's wrong here. And it starts to become an impediment on just living normally. So eventually it's enough to get you into the doctor's office. And once you're there, they list your symptoms. That's what they focus on, and then get lab work and other diagnostic procedures to confirm your diagnosis. So what does that diagnosis do? Well, the diagnosis defines the treatment protocol. But when we look in conventional medicine, what what that's all about is medications. So what medications do is they artificially block symptoms or artificially block the processes of illness. And people typically don't get well. 60% of our country, 6 out of 10 Americans right now are suffering from some kind of ongoing chronic illness. And that's been going up every single year. So even though we're spending more and more and more on healthcare every year, we're getting sicker. We're not
Yep.
getting well. So all of my events in life really caused me to start looking at that whole problem differently. So instead of defining, well, what's a diagnosis? I want to know, why is the patient ill? What kind of factors came together to cause that person's illness? And when it comes to chronic illness, that key question is not asked in the conventional medical community. And it's because it's not one factor, like just stepping on your ankle wrong and straining your ankle. It's a variety of different factors. But what I found in working with individuals and my own situation, I traced out, well, what are the possibilities? And you and I can figure some of those out. Most people are. So what are some things that contribute to illness?
Yep. Diet,
Diet?
lifestyle, yep. And then underlying chronic inflammation and
Okay, you're
Mhm.
wrong there.
Ah,
Okay. And that's the same mistake that most doctors make and most of our medical profession makes. They define inflammation as a cause of illness. It is
yep.
not.
Mhm.
Chronic inflammation is part of the process.
Yep.
It's really important to get those definitions right. All right. So,
Yep.
inflammation, chronic inflammation is a process associated with virtually all chronic illnesses,
Wow.
but it's not a cause. There are
Yep.
things that cause inflammation. So, I actually defined 5 categories of things.
Okay.
You got one, diet, eating the wrong foods. That's definitely it. These others too. Toxic environment. And that can be anything from mold in your environment to chemicals that we're exposed to chronically all the time, from pesticides and plastics and petroleum exhaust from cars. Um, Chronic emotional stress, that one gets you because it hits you when you're always in alert mode and you don't get sleep. That causes illness. Fourth category is physical factors, and that can be anything from trauma, just excessive physical damage to your tissues, to being sedentary, which causes harm by not moving blood, which is really important that we do that. And then that fifth category is the wild card, microbes. That's the big one. And we're going to talk more about that as we go. So it's not just Lyme disease and it's not just tick-borne microbes on this. And I'm finding connections to virtually every chronic illness and microbes. And so that's a big factor. Yeah.
That's so interesting you say that. It's funny because you could be healthy, like meaning you could be okay in 3 out of the 5 categories. And then if one of them slips, it's kind of like that's when the symptoms might start to kick up or stuff like that. But yeah, you find like parasites could be related, or like you say, the mold has been a big one, and trying to dig into that. So
Yeah.
no, I think those are great categories to break
Yeah.
into. So.
So that was kind of my first step, is asking that question, well, why, what was causing it? And I was thinking on, kind of a macro level of looking at those things. But as my journey progressed, I started asking that question, well, what is it actually doing to us? And it's what it's doing to our cells. So the human body is a collection of trillions of cells. Everything that happens in your body is a function of cells, whether that's thyroid hormone being produced by your thyroid cells, to heart beating, to brain impulses, to food digesting, to just walking across the room. Everything is cellular. So when you look at symptoms from a cellular point of view, you start to define symptoms. Like, so when I ask people to define the word symptom, they talk about, well, it's something wrong in the body and it's kind of nebulous. But when you take it down to the cellular level, exactly what a symptom is when cells are stressed or injured. So like if you step wrong and twist your ankle, you've damaged cells in the ankle, and so that's what's happening. So when cells are stressed or injured, a couple of things happen. One, they send out chemicals that activate nerves that tell the brain something is wrong. So we feel it as pain or discomfort. But the other thing that happens is you lose that function. So you can't walk on that ankle as well.
Yep.
So when you look at illness from the point of view of cellular stress,
Yep.
that changes the playing field quite a bit. And you start seeing how those categories of factors are actually interacting with our cells. And that was a huge step in my recovery and my understanding, because cellular functions just define everything in the body. And so when we start talking about cells, then we can start describing illness more specifically, right?
Okay. Yep. And do you find most conventional medicine doctors don't look at it this way? And
No.
wouldn't you be having this?
No, not at all.
Yeah, that's
Not even close. And most of medicine now is what we would call cookbook protocols, that, you have X symptoms and X labs, then you define this diagnostic protocol, and it's defined by the what drug or procedure you would put with that. And most all of it is basically defined by the pharmaceutical industry at this point. They're the ones defining a lot of the education. So looking at this thing from the cellular level, that sprained ankle, if you wear crutches, put a brace on it, it's going to heal, right? So it's another one of those things that we hear that word healing all the time.
Yep.
But what specifically healing is the ability of cells to recover from being stressed. Mm-hmm. So if the stress is relieved, like using crutches and wearing a brace, then cells can repair internal damage and regenerate new cells. But the stress has to be gone. If you keep walking on a bad ankle that's been sprained, it's just going to keep getting worse. Well, that's what happens in chronic illness. The stresses are ongoing. Yep. It's not letting up, so that cells don't have an opportunity to recover from being stressed. In other words, healing is impaired. So chronic illness is a state of chronic cellular stress. Yep. We have a lot of different chronic illnesses because we have different kinds of cells in the body that can be affected by different kinds of stress factors. But when you look at this thing from cellular stress, and that same principle of wearing a brace and using crutches can be used. If you find a way to relieve that cellular stress, then cells can recover and you can get well.
So how can people do that?
I was going to take it down, but said, I know you have a lot of people in the Lyme audience, and I wanted to take that microbe factor down a little bit bit deeper. And we'll go to the recovery part too. But this microbe thing, it turns out that it's a lot bigger than anybody really thought. And some of the research has only been in the past several years that we're starting to understand it. Everybody thinks of Lyme disease as an infection with a microbe, and that microbe makes you sick and you need to kill that microbe. And what I can tell you is just doesn't work that way. These are low virulence microbes. They have a low potential to cause illness, and we are exposed to a lot of things through our lifetime. Mm-hmm. So when microbes enter your body, all of these things, the Borrelia, all of these things we define as co-infections are intracellular. So when they course through the bloodstream, they're exposed, and the immune system and antibiotics can knock them out. But a lot of people don't even know they're getting them, because it's, the immune system does recognize most of our tick-borne microbes. We have immunity built into most of these things. But when they make it to tissues, they dive into cells and they live in cells. And when they do that, they take on a different personality. They lose their protective cell wall code, and they become almost kind of like a virus, and they replicate. So there's evidence now that we actually have these kinds of microbes throughout our body. There was a study in 2017 that showed that our blood cells, there have been a couple of different studies showing that we have microbes inside of our macrophages, white blood cells, red blood cells, and they are in this intracellular state, which is different, and our cells can function with the microbes present. So it's, this is kind of uncharted territory, that it appears that this idea that we get an infection and we become symptomatic and then we clear the symptoms, the microbe is gone, doesn't look to be very accurate. We keep a lot of things. Epstein-Barr virus, many other viruses, probably COVID, Borrelia, Bartonella, all of these things, some worse than others. But it appears what they're starting to question now is, are some of these microbes, these bacteria that end up in our cells, is it kind of a symbiotic relationship that they're important for us to be there? And that may be true. So the extent of it is probably much greater than people have ever really known. There was evidence in studies from 2015 and 2016 that we actually have a microbiome of the brain. We have hundreds of different kinds of bacteria that live in our brain.
Wow.
Yeah. And if they're in your brain, they're in your heart and your lungs and your liver and everywhere else. So we have these things, and it's with this dynamic relationship that these things are coming and going in our body. And you can live like that without symptoms and be healthy. We are kind of this colony, but eat bad food, get exposed to chronic stress, don't sleep for every other night for 20 years. Eat, and all of these factors come together and they stress our cells. And when cells becomes chronically stressed, the microbes gain the upper hand. So again, some microbes are worse than others. But we also know that different microbes have preference for different kinds of cells. So when you start looking at chronic illness from that point of view, of different microbes infecting different cells and stress factors coming along and precipitating, so the microbes are starting to become active and take over cells and come out and invade other cells, then you start looking at chronic illness from an entirely different point of view. And I find it fascinating.
I'm actually like mind blown right now with like fascination, because you do hear like that's what a lot of the things that come up with infection, or even going to a conventional doctor. It's like, for instance, a candida, or it's like, no, we're supposed to have that. You're supposed to have good and bad bacteria, or you call it good and bad bugs. But when you're talking about it now from cellular level, I'm like, wow, is it about just maintaining that balance to basically feel 100% and not let the bad bugs take over. So
so when you look at illness from that point of view, I think there is a place for all medications, especially in acute phases of any illness, to stabilize the body, to put us in a little bit better place, to reduce certain kinds of symptoms, I think can be very important. But if that's all you're doing, you're never going to make people well. You have to address these cellular stress factors, getting your cells healthy. And so, you in your journey and the other guests that you've had, you're addressing the big things. We have to eat a better diet. We have to clean up our environment and breathe clean air, eat clean food, drink clean water. That purifying ourselves, those things inhibit cellular functions. Stress, you have to manage stress. You've got a good night's sleep, and even sometimes medications just to get sleep in some stages can be very important. So it's we have to use everything at our disposal, but we've got to use some common sense behind how we do it. Exercise, what we're doing with exercise is moving blood. And we talk about here about detoxification, and everybody's taking all this junk that they're putting in the GI tract. The toxins are around cells. And what happens is congestion. So what chronic inflammation actually is when you have this state of your cells being stressed, you've got increased cellular die-off. The cells are dying, and it's creating debris and junk and congestion around your cells, which prevents cells from getting good blood flow, good nutrients, and also good waste removal. And they're not able to purge those toxins. So that's really important. So the first step in detoxification is flushing that space, which exercise, that's so important. But if you overdo exercise and you're inflamed, you hit the wall. So it's finding that balance. And for people who can't exercise, I recommend infrared sauna or some kind of sauna, because heating the body dilates blood vessels and it moves blood, and it starts that process of detoxification, which is so remarkably important. So all those things are really, really important.
So with the microbes being in, and I feel like even in the holistic space, I've heard that you can totally eliminate Lyme or these microbes and stuff like
Yeah.
that. So looking at it this way, it sounds different than that. So that's
Yeah, I don't buy it.
yeah.
I think we end up with what we've got. What I can tell you is I'm 65 now, and I've been quite healthy for a decade. And I can't tell you that I've eradicated these microbes. Our testing isn't good enough to know. It's
Nope.
not anywhere close. In fact, our testing is so limited that I hardly even use microbe testing.
Yeah.
I think there's value in it, but what we are testing for is scratching the surface of the possibilities. There, it's like just ticks alone. So we pick up things all through our lives. Ticks alone, one tick species was found to carry 237 different families of bacteria.
Oh my God.
So we're testing for a half dozen, just
Yeah.
scratching the surface.
Yeah.
So there are certain indications that I test, but this idea of we're going to test you and find out which microbes you've got so we can kill those microbes and get you well, it's a pipe dream. It doesn't work. So I did all those things. I cleaned up my diet. I gave up obstetrics call. I reduced my stress and cleaned up my environment, and restarted exercising again to find that balance of what I could and couldn't do. And I got some better.
Yep.
But that wasn't enough to fix it, because what happens is, once the microbes in your body get an upper hand, then just lifestyle and diet alone isn't going to help it. And that's where I found so much value in herbs.
Yep.
So herbs are remarkable. And I'm going to talk about herbs very generally for a minute, but we can come back and talk about them more specifically in a second.
Yep.
When you talk about herbs, basically what you're doing is borrowing a plant's defense system. It's a different way of thinking about herbs. So all plants are multicellular organisms, and they must defend their cells from free radicals and toxic substances and microbes of every variety.
Yeah.
And I've heard it said that plants are the best chemists on earth because they solve problems with chemistry.
Yep.
They use chemicals that we call phytochemicals, plant chemicals, that neutralize all these factors. And when you look at plants, all plants have a wide range of antimicrobial substances. They're producing a wide range of things against different kind of bacteria, different viruses, different protozoa, different yeast, different kinds of parasites. All plants are doing that. But all plants aren't compatible with our chemistry. It's like poison ivy is a great antimicrobial, but we wouldn't eat it because it also contains substances that are toxic to us.
Yep.
So the things that we would define as medicinal herbs are things that humans have been using for hundreds and sometimes thousands of years. And many of those herbs traditionally were used to treat things that we now know were chronic infections. So when we take an herb, we're taking that plant's defense system against microbes, free radicals, and all of these different things. We're also taking in the plant's chemical messaging system to balance communication. So a lot of plant chemicals are similar or the same as a lot of neurotransmitters and hormones that we have in our body, but they have a balancing effect. So we're getting all that. Different plants are exposed to different stress factors in different environments. So when you use different herbs, you get a crossover, that you get this synergy between different herbs. So that's kind of the magic of herbal therapy. And one of the most interesting things is that when you take an herb, you're getting a defense system that has an intelligence about it.
Yep.
And so taking herbs, something I recognize, when I did antibiotics, it destroyed my gut within a couple of weeks.
Yep.
Herbs don't do that. And I've actually found studies that they've proven that herbs suppress pathogens in the body, but not normal flora. So we're hitting the bad guys without knocking out the good guys,
Yep.
which means you can take herbs for a long, long time, which is exactly what it takes to balance all this stuff that's going on in your body.
Yep. That's incredible. I've never heard it described that way, but it makes so much sense when you think of it. And there's a reason why people have used these things for hundreds and hundreds of years. Yeah. And that's so, how did you even come across this? I know, being a doctor yourself, and then you were like, okay, because I feel like everybody hits that plateau. And I hit it myself I was like, I have a clean diet, I'm exercising all the time, I still feel like crap. And I remember family and friends would be like, just work out more, go into calorie deficits and do this. And I was like, no, so how did you figure out how to even find the right herbs and things to work with? So
desperation and fate.
yeah.
It was everything I tried, and everything within the conventional cookbook didn't work. And I totally lost faith, and I was in trouble. This was before I, started identifying with chronic Lyme disease. I developed a really serious heart issue, that my heart was skipping beats every second to third beat. I had chronic chest pain, shortness of breath. I really lost my ability to exercise, which was dear to me. Exercise was stress relief, and I couldn't do it anymore. And it was really scary. I ended up with a cardiac cath. The doctor said, well, we don't really know exactly what's going on, but your coronary vessels are clear and you can take this beta blocker drug. And I tried it, and it made me feel horrible. And at that point, it was like, I may perish, but I'm going to find some other angle than this.
Yep.
And it wasn't long after that I found evidence of some of these microbes associated with Lyme disease. It's like, in my opinion, the only difference between fibromyalgia and chronic Lyme disease is the person with chronic Lyme disease has found some way to get a positive test for a microbe, because they think that's the way to get to wellness, and it's just not.
Yeah, no, I've seen too. It's like lupus, fibromyalgia, or Lyme, and they do these comparisons because it's all, Yeah, it's all
Yeah.
misdiagnosed
Yeah.
all the
So when
time.
you start looking at illness as cellular stress, it just puts you in a different place.
Yep.
So I um, I was pretty desperate and started looking at alternative therapies. Through a course of a couple of years, ended up being certified in holistic medicine. I tried various kinds of things. All of it worked fair at best. I did not have the resources or the ability, because I was still, had a small practice, medical practice, to go to Lyme doctors, which I thought was, that at one point, like everybody, I thought that was the key. And now I see it was a blessing. I mean, fate just kind of kept steering me in the right direction. And this was around 2005, and a guy named Stephen Booner had issued a book called Healing Lyme that defined an herbal protocol. And, I didn't have anything against herbs. I just thought, they were kind of weak versions. I had tried herbs here and there, but
Yeah.
I had tried them in really low doses and really didn't know what I was doing. And this said, no, we're going to load you up with a bunch of different herbs, and we're going to use really good extracts. And I said, okay, I'll
Hmm.
do it.
Yep.
And I did. And within several weeks, started feeling better. And several months, really started getting my life back.
Wow.
And that was the point where I became a believer, but also said, I need to know what's going on here. And really, so herbs became a passion that's consumed me ever since.
Wow. That's incredible. Like that's, and um, it's so funny too, because I think people hear herbs and they have your initial reaction. Even to this day, I can't believe, like even back in 2005, there was even less information then.
Yeah.
So but it's funny because now, and even my sister's a nurse practitioner and stuff, and she's like, oh, you go take your stuff that works or whatever. And I think there's a really big misconception about
Yes.
herbs and what they can do,
Yep.
um, and everything like that. So it's nice having a doctor
It,
that's been
it,
through it and studied it, and now yeah.
I think all my entire journey has brought me to this place of being this very unusual mouthpiece for the importance of herbs coming from a conventional physician. And I think that's still very prevalent out there, that people think of herbs as being a weak version of drugs. And we're so symptom oriented in this country. It's like, well, if I've got this symptom, I take this drug. If I got this symptom, I take this drug. Well, they're trying to do, but they don't want to go to the doctor and they don't really want to take a drug. So they try the herbs. Like, I have this symptom, so I've heard this herb works for it. That's not really the importance of herbs. So what the herbs are doing is counteracting cellular stress. And that was the big aha moment that really caused me to write this particular book, The Cellular Wellness Solution, is that I realized, so what we're doing with a drug is it's a potent chemical that basically poisons an enzyme or activates a receptor pathway in a specific way. And what we're doing is altering cellular behavior to try to artificially reduce a symptom or slow the process of illness. But there are no drugs that I'm aware of, or very few that do this in any way. Drugs do not reduce cellular stress. They artificially block symptoms or processes of illness like inflammation. But if you don't do something about the stress factors that are driving the illness, you're never going to get people well.
Yep.
And,
Yep.
and so, yes, eating better diet, living better is very important from a cellular wellness point of view, but the herbs are acting completely differently. So drugs don't promote healing.
Mhm.
So what we're doing with the herbs is we're addressing the stress factors.
Yep.
Herbs have anti-diabetic properties. They actually address a lot of our dietary woes. Now, taking an herb is not going to substitute for eating a bad diet, but it can help protect your cells. Herbs help promote detoxification of toxic substances and help neutralize toxins. Herbs inhibit free radicals that are part of excessive metabolism and also part of a lot of toxic substances. Herbs, the hormone messengers, help balance and counteract our stress hormones and bring our stress level down, and reduce that impact and help us sleep better.
Mm-hmm.
Herbs affect a lot of physical factors, and herbs definitely help balance the microbiome. So I think when you look at herbs, that concept of balancing the microbiome, inhibiting pathogens, not just in the gut, but throughout all of our tissues, but allowing our normal flora and this complex relationship with bacteria that we don't even understand yet.
Mm-hmm.
It allows that. So the herbs, in a way, are smarter than we are. They're doing things that we don't even completely understand yet. But you can tell what it's happening is it's counteracting all these stress factors. When you reduce cellular stress, cells are able to recover and regenerate new cells. So drugs don't promote healing. Herbs promote healing. That's the key difference. Herbs promote healing. So instead of artificially inhibiting a symptom, the herbs are blocking the stress factors and allowing cells to heal. Well, healing takes a long time, and we're not very patient. And that's why we think that herbs are weak version of drugs. We're not giving them long enough to work. But instead of, if you take a drug to block a symptom, every time you stop the drug, the symptom keeps coming back. Whereas if you take an herb, the symptom is just going to melt away because healing is occurring to the point that you don't have that symptom anymore. And that is a key difference between herbs and drugs.
That's huge to think of it that way too. And like, have you found, I had a question. I was like, what was I just going to say? No, it had to do with basically, people want that quick fix. That's what even when I was on my healing journey, I remember someone was like, oh, you look great. What probiotic are you on? And I almost I didn't want to laugh in their face, but I was like, oh, no. This has been like 2 years of doing all of those 5 categories that you mentioned in the beginning. So it's really we just have that quick fix attitude. So it's funny, but we have to switch our thinking to that's not going to lead to true health.
Well, I think it's trying to capture the best of both worlds, and that's where I would like to take my journey, is help people see that there's value in both places. When it comes to acute intervention of illness, we do a great job in conventional medicine. And sometimes to interrupt symptoms, the potency of a drug is very, very important. But look at a world where you were managing illness, using the tools that we're doing and helping people get a handle on things, help stabilize the body with our medical system, but then complementing that with herbal therapy and dietary modifications and all of the things that you would be, a health coach would help you with that. That's going to cost a whole lot less money than hiring a physician. So what if you merged all that together? Think of the symptom that you'd have, and we'd probably get a rate of chronic illness pretty quickly down to about 20 or 30% of the population instead of more than 50% of the population,
Yeah. And do you find too, so with the herbal supplements and everything, and so I would love to get into too what you've created and kind of how you go about it, but do you think people need to be on the herbal supplementation their whole lives, or is it about getting back to balance and then maintaining that balance and maybe doing some maintenance stuff through the years?
Yeah, I think that is another misconception, that, we use medicinal herbs to treat symptoms, treat illness, whatever. And then when we get well, we stop them. And what I'd like to do is make a case that there's certain herbs. When you look at that thing called herbs, there's a pretty wide range, and there's certainly some plants that do have drug-like properties. But in the book, I defined a category of herbs that I call the everyday herbs that have a low potential for toxicity. They don't have drug-like effects, and they're predominantly just protecting cells. And I would make a case that, yeah, we all need to be on those. And if everybody in the country was taking a handful of herbal capsules every day, our rate of illness would probably be substantially lower just because of the benefits that would have.
Yep. Yep.
So I think it's really important. My particular case, I did that thing when I would start to feel well and I would stop the herbs, and then stress factors would come along and I'd be right back where I started and thinking, well, I haven't gotten rid of these microbes yet. They're flaming up again. Here we go.
Yep.
And I'd restart the herbs. And I finally got to the point where I went, I feel a lot better when I'm taking the herbs.
Mm-hmm.
I'm just going to keep taking them.
Yeah.
And I've been taking herbs continually for a decade. I'm 65. When I was 50, I really had concerns that I would be needing hip replacements and knee replacements pretty soon, and that I was going to live, and sooner or later I would end up disabled, and that's how I would live my life. I'm 65 now. My knees are great.
Yep.
I'm kite surfing. I'm doing everything that I want to do.
That's amazing.
And so my resiliency, my blood pressure is lower than when I was in my 30s. My cholesterol is lower than when I was in my 40s. I don't take any drugs for any of that stuff.
Wow, that's incredible. That's incredible. There's something to be said for that. That's fine. And what are some of the other big misconceptions about, herbs and supplement, or just medication, or the whole world of this in general with microbes?
Yeah, a couple of misconceptions. I think people throw herbs and vitamin supplements all together, and they're two very different things. So when you look at vitamins, what we're talking about here is nutrients. So nutrients are things that cells need to function, right? So our mitochondria need certain B vitamins, different enzymes that are in the working parts of cells need certain minerals. We need coenzyme Q10 and various kinds of things for our mitochondria to work. But when you look at nutrients, it's really better to get them from your diet, ideally. Not to say that you can't supplement a little bit here and there, but if you do it for food, they're being slowly released as your cells can utilize them, rather than getting one big load all at one time. So, but those are nutrients. So when you look at herbs are poor nutrient sources. They don't have calories that are to any significant degree. They're not supplying minerals and nutrients and vitamins to any significant degree. What we're getting from the herb is these protective phytochemicals. So when you take these protective phytochemicals, this is an interesting way to think about it, So when cells are stressed, they need more nutrients. They draw a lot more vitamins and everything else, all right? So when you take herbs and you take these phytochemicals that are protecting your cells, you decrease nutrient demand. Cells don't need as much vitamins and minerals because they're not turning things over if they're less stressed. So even though herbs don't provide vitamins and minerals, it decreases the cellular demand for those things. So that really works in your favor in a big way. The other thing is that these are things that are missing from our diet. And if I had to label the biggest new deficiency in our modern diet, a lot of people would say vitamins and minerals. Well, we're getting basic enough of those. If we weren't, we'd die.
Yep.
But what we aren't getting is protective phytochemicals.
Yep.
Because when you look at our food plants are cultivated to produce calories. So to do that, we have the plants have given up some of those protective properties, and we grow our food plants under controlled conditions to maximize the yield of calories. But what we do in protecting them from microbes and insects and other kinds of stress factors is we reduce their ability to produce these protective phytochemicals. So even our healthy food plants, celery, broccoli, all of those things, eat those things. They're really important, but they're still not going to give you the kind of protection that you're going to get from a wild plant. So herbs are wild plants,
Yep.
and they retain all of that wide spectrum of protective properties. But it's also probably what we were eating. So for hundreds of thousands of years, humans ate a forage food diet, and it was
Yeah.
wild plants, and they were getting tons of this stuff, and we're not getting it anymore. And I think it's really sad. So that alone is an argument that we really should be supplementing our diet with herbs to help us to restore those protective phytochemicals that we're just not getting anymore.
100%. And I also think too with herbs, and because there is a like big discussions or big, it's another, I don't want to call it a fad by any means, but I think it's coming up and becoming more popular, but it's making sure that they're clean, because there are so many products out there right now too that aren't and being mixed. So how do you recommend finding clean herbs and the right herbs? And I know you've created your own program, so would love to hear more about that too. So
We do. I mean, part of this, my journey carried me to actually create a herbal supplement company, and that was a frustration that was prevalent. When I was first looking at herbs and incorporating them into my medical practice, is how do I get good stuff and which ones do I use? And I found that a lot of products were substandard, and that's a big reason why people don't get results, is they're using substandard products.
yes.
So how do we get those best extracts? So the pathways that we go through are important. It adds cost, so sometimes you get what you pay for, but having products that are it's really difficult to, like, if you set out to create an herbal supplement company and you were going to grow all of your own herbs. Some companies do that and they're successful at a certain level, but it's hard to get the wide variety of things that you need because everything doesn't grow in one place. So what we do is look to the source. We are looking to know where an herb is being raised and what fashion. So we want to go all the way back to the source. Defining how good it is something called a certificate of analysis. So we always insist on a certificate of analysis with any batch of herbs that we get. And that is a third-party signature analysis to define, is it the right species of herbs? Because you do see species substitution. Does it have the concentration of key phytochemicals that we were looking for? Is it free of bacterial, pesticide, and heavy metal contamination? So those things are key. But even that, we don't sit on that. We actually take a sample from the batch and send it to our independent lab just to make sure that they were actually giving us the right story. And we're using the highest potency and concentration of extracts as we can use. But then, through the manufacturing process, we're actually testing it 3 different times to make sure that the consistency of the ingredients is there and everything is like it should be, to bring the highest level of product that we can do. There are other companies out there that are doing that, and you just have to do your homework, and part of it is working with a company and developing trust as a reliable source, that the company is doing their homework and they're going to do everything in their power to bring a good product to market.
Yeah. Okay. And so with your company and everything like that, can people work with you or people members on your team? Because I know it's like they might be in more, I don't want to call it maintenance mode, but someone might come in with a lot of inflammation and be like, okay, like I'm gonna, you know, are there people to work with to um kind of with how to use the supplement, the herbs and everything?
Well, our particular company, yes, I spent a lot of time training our customer service people. We're a relatively small company, and you actually talk to a person when you call us, and that they can really help you with a lot of information. We put a lot of information on the company website. I also have a website, RawlsMD.com, that has a lot of good information, and my book, The Cellular Wellness Solution, that's out now that people can find at cellularwellness.com. I put a lot of information that helps a novice or somebody naive to herbs go through that whole process and develop the confidence they need. And we really haven't gone into specific herbs. The book gives people a starting point. Where do I start with herbs and where can I build out from? So that kind of information is in the book too. But yeah, we have a great customer service. We put as much information on the website as we can. I think that people have to understand, though, that FDA and FTC restrictions really prevent any reputable supplement company from putting much information on their website. It is so restrictive that I can't use the words promote healing with a product, much less discuss any disease in any capacity. So it's very, very limited. And what you get from a lot of company was what I called pseudoscience or hype. And so, when you're looking for good products, the first thing that I do tell people is look for the ingredients. And you want to find a company that has the ingredients very visible and tells you what's there. And I wrote a lot about this in my book. That all the time I pull up websites that you're just got all this, you're bombarded with all this hype and pseudoscience, and then you go looking for what's in the product, and you can't find it, or it's buried somewhere. And typically when you get around to finding it, they're selling junk. And that's pretty common. So it is important to find that trusted source.
Yes, 100%. And I know we did mention, but are there a couple herbs that you do mention in the beginning to get started with?
Well, they're always favorites. And just, from that category of everyday herbs, which includes herbs that we call adaptogens and others, one of my favorites is rhodiola, which helps us adapt to physical stress. Reishi is a mushroom. So we talk about plants, but many mushrooms have those same qualities. And of course, like plants, there's some poisonous mushrooms and there's some mushrooms that are fantastic. Reishi has been studied as being a really potent anti-cancer substance. It has antiviral properties, really awesome. Turmeric, most people have heard of turmeric. It's been very well studied. It is thought that it's the reason why people in India have such a low rate of Alzheimer's and cancer. Gotu kola is another one from India that I really like, that protects our brain. And I always put milk thistle on the list. Milk thistle is a great herb because it protects your liver. So we're exposed to a lot of toxins in our world today. And people, 25% of the population has fatty liver. They've replaced a substantial number of their liver cells with fat cells. That's why your cholesterol goes up, because you lose the ability to process cholesterol, but you're also losing the ability to detoxify. So protecting your liver cells is really important. Milk thistle has been shown to promote regeneration of liver cells. Fantastic. I've been taking it for 15 years.
That's interesting.
So, and then another substance that I put on my list, prime list, is something called shilajit, which is actually a plant substance from Himalaya that's fermented with bacteria. And I put it in there because if you look at our ancient forage food diet, people used to eat on the ground, and there was a lot of dirt and soil microbes in their food. And so even herbs aren't getting some of that. So that brings in that dynamic that connects us with our ancient past in just a different way that herbs can. So I think all of those things are interesting. And so all of those herbs have some antimicrobial properties, but then we have a list of herbs that you can take on a long-term basis that are classically used for things like chronic Lyme that have stronger antimicrobial properties like Japanese knotweed and andrographis and catswell and Chinese skullcap. Those are all wonderful. But they all have those protective properties. So when you start reading about these herbs, you find that they're doing a whole lot more than just killing microbes. Because again, this is about balance. It's about restoring the balance of cellular health and that dynamic relationship that we have with friendly symbiotic bacteria and the pathogens.
Yep. No, my mind is blown right now. And like, I've been in this and studying it, and I've been on some of the supplements, but it's just, I'm super excited to go research, read the book, and all of your information will be listed too in our information. But, what's one piece of advice that you have for people in life or on their health journey or just in general?
Oh, take herbs. Absolutely. I've talked a lot about herbs, and I've certainly investigated other kinds of things. There are a lot of different kinds of therapies that we can do, but I always look at it from the point of view of, are you actually promoting cellular health with this thing? And I think that has to be central to wellness. If you're not promoting cellular health, you're not going to get well. And that's so remarkably important. And I think herbs should be something that people are really paying attention to for that purpose.
Yep, 100%. No, it makes sense. This is just a side question too. Can any of these herbs interact with medications that people are on in general, or like, should people ask a doctor or ask a practitioner before they start taking any of the herbs?
Yeah. It would be really nice if people could go to their doctor and tell them they were taking herbs and ask advice, and the doctors just don't know anything. And they, 10 times, 9 times out of 10, they just say, oh, don't take that herb.
Exactly. Yep.
And there are herbs that are more concerning. And that's something that is this idea that I had for the book, that I created this thing called the herbal spectrum, that is looking at that full range of plant substances, starting with food plants all the way to drugs. Now, 70% of our drugs are originated from plant sources. But, people think, oh, well, our drugs came from medicinal herbs. No, our drugs came from poisonous plants. We're looking for toxic chemicals in the plant. So typically plants that drugs came from were never used regularly as herbal therapy. But it puts that spectrum out there of herbs that, maybe you do need to ask your doctor about or stay away from, but, puts you in a category of what I call everyday herbs that have a very, very low potential to interact with drugs because they don't have drug-like effects. They're basically just protecting cells. So I think there's a lot of good information in the book that will really answer a lot of those questions that so many people have.
Yep, 100%. That sounds it. Well, Dr. Rawls, I just want to thank you so much. I mean, I wish I could pick your brain way more often, but just such good information. And I'm super excited to, get your information out there and help answer any questions that people might have. But yeah, thank you so much.
Well, thank you so much for the opportunity.
Thank you so much for taking another holistic view of your health with us. I hope you've really enjoyed today's discussion, and as always, take control of your own wellness journey by exploring the practitioners and modalities available near you or on our directory at www.holistichealthcollab.com. Don't forget to subscribe here so you don't miss an episode, and you can also find more holistic health tidbits at Holistic Health Collab on Instagram. Please leave a rating and review to help us reach more people that might need to hear this information. If you have any questions about today's show or any ideas for future episodes, or if you just want to reach out, you can contact me directly, Kate Maslowski, at kate@holistichealthcollab.com. You can just put podcast in your subject line. Again, thank you so much, and I hope you have a great day.